Good afternoon from the Iowa State Capitol. This is the last week before the first funnel deadline, and while the temperatures outside may be sub-zero, the Capitol's been a hotbed of activity this week. Legislators have had a flurry of subcommittees trying to move things forward so that their passions and their policy ideas will stay alive for the rest of the session. So the three things you need to know about this week. Number one, SSA and equity. Both the House and the Senate passed their respective versions of supplemental state aid and the transportation district cost per pupil equity bills. Procedurally, what happened is the House substituted their version into the Senate bills, sending them back to the Senate. The equity versions, they agreed with the slightly higher number that was included in the Senate-passed bill, about $400,000 more in their proposal, and that sends the bill directly to the governor. Unfortunately, February 13th is here. It is the 30-day deadline, and we don't have an agreement. I was having a conversation this week with a Republican member of the House who's closely involved in the negotiations and was asked this question. Are you more interested in getting it done in 30 days, or are you more interested in having us hold firm for 2.5%? Well, the answer is obvious. Of course, we're going to want that highest number as possible. So I've encouraged them to maintain their position, and I think they're doing a great job, and hopefully we'll have this resolved in the next couple of weeks. Number two, the classroom, therapeutic classroom, behavioral violence in classrooms bill is moving on both sides. There continues to be a lot of discussion about how we might improve some of that and making sure that we have the appropriate guidelines and evidence-based standards. And so I call it a work in progress, but I think it's a really good work in progress, and a lot of diverse groups are coming together. We're working very closely with the Iowa State Education Association, with administrators, to talk about how we can improve upon this bill. I anticipate that will also ultimately become law as it moves through the process. Finally, we have school-based telehealth, which has really been something that IASB has worked on for the last couple of years with some of our partners, including the Iowa Medical Society, to try to provide a framework and deal with some of the reimbursement issues that schools face when trying to deliver mental health services in the school. This bill has passed out of the Senate Education Committee, making it funnel-proof, so we'll be looking forward to further action on that. In the meantime, please continue talking to your legislators about the need to resolve as quickly as possible supplemental state aid at the highest level possible, and make sure that you follow our podcast that will be released later this week that talks a little bit more in depth about the provisions of our school telehealth bill.